you can help reduce health inequalities. What are social determinants of health? You may have heard or read about health inequalities and disparities as being a problem in the U.S. today. But what exactly do we mean by health inequalities and disparities? Health inequalities and disparities are avoidable differences in people's health across a community. They don't happen randomly or by chance. They are socially determined by circumstances largely beyond an individual person's control. We call these social, environmental, or economic disadvantages social determinants of health. We need to understand social determinants are root causes of health inequalities. Let's consider examples of how social determinants impact people in North Carolina. Black mothers are more than twice as likely to suffer miscarriage and stillbirth than white or Hispanic women. The evidence clearly shows fetal death rates vary by race in North Carolina. Social determinants can also reduce average adult lifespans. Which group do you think has the longest lifespan in the United States? Black males, white males, Hispanic males, black females, white females, or Hispanic females? Actually, white females have the longest lifespan in the United States. White females can expect to live 9 years longer than black males. Let's look at the U.S. life expectancy at birth by race, ethnicity, and sex for babies born in 2016. We can see the average lifespan of black males is the lowest of all 6 groups. Let's consider what's causing these health inequalities. Have any unfair policies and practices over time helped make this health inequality possible? Do biases still exist in policies and practices that affect length of life? To identify the social determinants that need work, we must first understand the root causes of health inequalities. In addition to being affected by our race, how long we live can be different depending on where we live. Take a road trip on US 64 from Wake County to Martin County, North Carolina. When we leave Wake County, average lifespan drops from 80 years to 77 years when we arrive in Franklin County, North Carolina. When we leave Franklin County and arrive in Nash County, it drops 2 more years. When we leave Nash County and arrive in Edgecombe County, it drops another year. And when we finally arrive in Martin County from Edgecombe County, we have our final drop to 73 years. The average lifespan decreases 7 years across 5 counties. Why do babies born just a few counties apart average such different lifespans? The answer is, each community has its own unique social determinants of health. Some communities have limited access to doctors and hospitals. Education and income levels vary. This impacts access to food, medicine, and other essentials for good health. Isolation from good jobs and social services can have a powerful impact. Stagnant economies can create and sustain poverty. The negative impacts of social determinants affect all U.S. communities, not just North Carolina. As such, the problems caused by social determinants are a significant problem in the United States. Can individuals like you help reduce health inequalities in your community? Yes, you can help your community. Start by doing 3 things. Task number 1. Learn about social determinants by watching our complete series about health inequalities. Next, get ideas for projects you can do in your community. Task number 2. Share these videos at school, work, and church and pull together a team. Even small teams can have a big impact. Task number 3. Visit web pages for Charlotte AHEC and county health rankings. for project ideas that fit your interests and community needs. County Health Rankings website is at www.countyhealthrankings.org, and click the link in this video's description to visit the Charlotte AHEC Social Determinants webpage. Remember, health inequalities and disparities are avoidable differences in people's health, and you can be part of the solution. Be sure to watch our other health inequalities videos.